what we're talking about today is giving a report, and as we've discussed in class, we give report to ensure that there's a safe and accurate transfer of information from the offgoing nurse, which is going to be me in a minute, to the oncoming. Always got to remember that any notes that you take on your patients are confidential. You don't want to take them out of the building. You really need to shred your notes before you leave, because that would be a violation of HIPAA. And in the case of postpartum care, there are specifics that we want to cover in the giving of that report. And a point that I want to stress, because some of you are going to be on units where they do not practice the mother-baby model of care, but it doesn't matter if they don't practice the model. As the postpartum nurse, you still should know what's going on with that baby, be it in ICN, TCN, or anything else that's going on with the baby. So some particulars, and this is in your workbook, is that you're going to give the name and location of your patient, the gravidoparity, the date that she delivered, the method of delivery, the type of anesthesia, her blood type, her GBS status, IB site, feeding methods, complications, and pain. And now we're going to hopefully mirror a best case scenario of a report for you. Okay? So, how was the traffic today?
Oh, it was really bad.
Really?
Yeah.
Well, you got here on time
I
anyway.
sure did.
So good for you. So Mary, I'm going to give you a report on your patients today, and the first one I want to talk to you about is Noelle Sims. And Noelle Sims is located in the CND Bay number 4. She's a 32-year-old Caucasian, 32-year-old Caucasian woman. She's a Gravida 2 Para 1001. Her EDC was 5/18/08. She delivered this morning at 04:12, and she delivered at 39 weeks and 5 days. She's A negative, and we sent the cord blood down to test the baby, and she was beta strep negative. She delivered over an intact perineum with no anesthesia, and I have ice to her perineum right now still.
Okay.
She delivered a baby boy. His name is Ricky, and he weighed 2,950 grams.
Okay.
He's breastfed. They do not plan to circumcise him. Noelle is on Medicaid, and they don't want to pay the $250 for the circumcision.
Okay.
She nursed her first baby, and she plans on breastfeeding this baby also. She nursed right at the time of delivery, and then she nursed again about 6:30 probably. At the time of delivery, she nursed 20 minutes on each side, and the last time he was real sleepy and would only nurse about 15 minutes on one side. I'm a little concerned. She's kind of mechanical with him. She's real stiff, and she just doesn't like cuddle him in like I would think that she would at this point. So just kind of keep an eye on her. Her husband is in the hospital. He's having some sort of cardiac difficulty. He's here at Duke too. So her mother's been with her most of the day, and she's still at the bedside with her. Hopefully, maybe at some point, if he gets better, they could bring him down in a wheelchair.
Okay, great.
Okay.
All right.
Okay, anything else?
Now, has she been medicated?
I did medicate her with some Tylenol.
Tylenol.
And that was about 5:30. She was complaining of some pressure on her perineum, and I medicated her.
Okay, so Tylenol at 5:30. Okay. And does she have an IV site?
She's got a hep lock.
Hep lock? Where is it?
It's in her left forearm.
Okay, left forearm. Okay.
She got here. She was pretty advanced in labor when she came, and she didn't want anything for the pain or any medication. She delivered about an hour and a half after she got here, so they barely had time to get the IV in.
Wow.
Yeah, she went really quick.
And you were talking about the breastfeeding.
Yeah, she's nursing really well, other than she seems to hold him back. It's almost like one of her arms is kind of stiff, you know, so it may have been from pushing or something. She just doesn't pull him in like, so you might help her with positioning a little bit today. She seems to be, I quizzed her on a few of the teaching topics, and she seems to be pretty clear about baby care and breastfeeding and how often to put him to breast and everything. But
but we'll work with her on some positioning
yeah, I'd
for
work
breastfeeding.
with positioning.
Sure. Okay.
Okay.
Sounds great. Thank you so much.
Okay.
Have a great day.
Yeah, you have a great day
Thanks.
too.